My name is Mrs. Su Lennox. I'm one of the senior dental nurses and I work at the City of Coventry Health Centre. I think the special care dentistry that we offer here for our patients is very important and takes up a large portion of our care that we offer. Orthodontics as well does, and probably our anaesthetic consultations as well plays quite a large portion of the role that we have here. Again, we need to encompass the care for clients that can't get it elsewhere. I think we started moving in December 2011, just after Christmas. And I think within the first week of the new year, we were virtually up and running. It made quite a fast impact on us because initially we had got 5 other clinics around the city of Coventry. And the majority of those closed in one go. One we stayed open, obviously, so we could keep the care open to our patients. And then we all relocated here. It's meant then now that we're one large team, which improves then the service as well, because of course you can communicate with your other colleagues, share your knowledges and skills. The patients can get a much better quality of care in as much that we could perhaps do all their treatment in one visit, from the checkup to seeing our oral health team, getting x-rays done, and it saves them having to be transported backwards and forwards as well. This is good, central location. Everybody can access it. We think we had one or two, we did a patient survey not so very long ago, and we got a 96% satisfaction rate about coming into this new building. I think again the access to the building helps enormously. Once they've reached our department, of course, we have, as I say, the advantage of having various clinicians with perhaps more specialised skills all on site at the same time. It makes us one big team. If they need to then consult with each other in order to provide the best care for this patient, they can do it on the day, one time. There's no emails, there's no phone calls, there's no setting up another visit date and so on. The patient could be seen by a variety of multidisciplinary classed members of staff and get, as I say, all the treatment they need in one visit, as long as they're up to it. So again, they could be seen by a routine dental surgeon to have their examination. We could see the specialist surgeon that does the surgical day unit, and if they need any x-rays or anything else done, patient complying, of course, we can get it all done in one visit. The advantage as well, really, from other resources point of view, is that we only need a much more limited amount of stock, whereas we had to stock 6 clinics with equipment and materials and various x-ray machines in every single one. We've managed to obviously hone it down quite nicely to only having the one amount of stock. We've now got surplus instruments because we just don't need them anymore. So from that point of view, equipment-wise, resource-wise, we've managed to minimise that quite considerably. And as I say, all the staff are here as well to support each other and inform each other and train each other as well. The other advantage, of course, of being in this nice new health centre is that we are a multidisciplinary service. It's very nice to be able to share these facilities with other services from our point of view and from that of our patients. We will get asked questions about the facilities that are here and that can be provided, and it's very nice then to be quite easily and comfortably be able to inform them and give them the help and advice they need and redirect them to the services. It does make referring our patients to them a lot easier as well, because if necessary you can actually go and talk to someone first, find out what are the requirements and regulations regarding referral,